So I got to tell you a couple of things about Sheila. Sheila and I and her husband, Mac, we've been friends for 12 years. Mac, unfortunately, passed away a little while ago, and he and I were co-leaders of the Atlanta-based Metropolitan Area Carcinoid Awareness Group, and which I co-led with Mac and of course with Sheila until 2017 when I moved to Israel. So I have asked Sheila, and we've been through this thing quite a few times. This is the third version of the narrative, because she started talking about Mac, and the second version was less about Mac and a bit more about her. And then I said to her, no, you're not getting this. I really want to know what happened to you, because very few caregivers are honest enough and open enough to talk about what they go through. And Sheila wrote the presentation that you're going to see today. We've tried to do it in video, and I think this is the 6th time that we're doing this thing together. We had to get a headset. It's been a journey. Mac unfortunately left us too soon after many years of playing hide and seek with his disease. And without any ado, I think we're just going to start.
Greetings from Atlanta. I would like to thank Michael for asking me to be a speaker at this conference. It is an honor to be included with such an esteemed group of people. My husband, Mac, was diagnosed with carcinoid cancer in 2000. I call it carcinoid because at the time of his diagnosis, that's what it was known as. I know that in the video that you will watch, he says that he was diagnosed in 1997. I did not realize until months after the video was made how much his mind was already affected. I was privileged to have been his caregiver for 18 years after his diagnosis. I was not prepared for what life threw at me. So I share my experience as a caregiver with all of you in hopes that I might in some small way help those who are presently a caregiver, or for those who wake up one day and suddenly find that they have gained a new title, caregiver. I want you to understand what you may experience as a caregiver. I want you to know that you will have good days and bad days. But through faith, family, and friends, you can get through anything. After we retired in the mid-1990s, we planned to spend our time doing those things we had put off doing while we were working. But in July of 2000, Mac had an episode of severe vomiting and abdominal pain. After several hours, I finally persuaded him that we needed to go to the ER. ERs are usually busy on Sundays in Atlanta, and we would jokingly say that by the time you saw a doctor, you were either well or had died. Mac had several tests, including a CT scan, and by the time we did see a doctor, he had stopped vomiting and the pain was gone. The treating physician told us they could find nothing wrong. 4 months later, Mac again began vomiting and having severe abdominal pain. This time, when we went to the ER, tests indicated that he had a blockage in the intestinal area. He was admitted to the hospital and they told us he needed a surgeon. The surgery involved the removal of his appendix. We later learned there were a cluster of lesions surrounding this area and 15 inches of his small intestines. He spent 2 weeks in the hospital and recovery was extremely difficult. We did see the pathology report prior to leaving the hospital. It mentioned carcinoid, but the word had no meaning for us. Cancer was not even on our radar. At the first follow-up visit with the surgeon, we were told that there were spots in the liver and that he needed to go to Emory University to see a liver specialist. At our first visit to Emory, we were waiting in an examination room, and a nurse sticks her head in the door and says, "Mr. Caudill, how long have you had cancer?" I guess she could see by the expression on our faces that we were totally shocked by her words. This one sentence, "Mr. Caudill, how long have you had cancer?" began monthly doctor appointments, 2 additional surgeries, blood tests, CT scans, octreotide scans, MRIs, and sandostatin injections. When Mac was not at a doctor appointment or on the golf course, he spent a good deal of time on the computer researching this disease. Eventually, he would know more than the oncologists we were assigned to at Emory. Mac wanted a doctor who specialized in carcinoid cancer. We learned there was not a specialist for this disease in Georgia, but his research led us to doctors in Florida and Louisiana. After Mac's recovery from his first surgery, we enjoyed life. We visited family and friends in other states. He played golf several times a week. We went to movies and out to dinner and traveled throughout the United States and Canada. But all of this was done between the times we spent with the oncologist keeping track of his disease. However, the specialist oncologist we saw always had a wait-and-see approach. Now, if you knew Mac, you would know he did not have a wait-and-see approach. New slide. In the spring of 2007, a friend of ours had surgery at Johns Hopkins Medical Center in Maryland. Several of us flew to Maryland to be with him and his wife. Before we went to Maryland, Mac decided to see if there was a doctor at Johns Hopkins who was knowledgeable about carcinoid cancer. Again, through research, he located Dr. Michael Caudill. During this time, I felt it was my job as caregiver to support any decision Mac made pertaining to his disease. I had basically been quiet during the visits to Emory, Florida, and Louisiana, but when I met Dr. Caudill, I felt we had found the doctor for Mac. In Dr. Choddy's capable hands, Mac had a second surgery in 2008 at Johns Hopkins, which entailed removal of lesions in the abdomen and the RFA procedure on lesions on the liver. After 5 days in the hospital and 2 days in a hotel, we flew back to Atlanta. Mac recovered quickly, went back to playing golf and enjoying life. Mac's research also introduced us to a couple from the Atlanta area, Laura, a newly diagnosed patient, and Ed White, who were interested in forming a support group in Georgia. This was the beginning of the Metro Atlanta Carcinoid Awareness Group, also known as MACAG. The group began in 2004 with 3 patients and 3 caregivers. In March of 2009, Laura, the Georgia group leader, died. Her disease was too far gone by the time she was diagnosed. For years, her doctor told her she had IBS. Mac was asked to take over as leader of the group. He became knowledgeable about his disease by doing research and going to conferences. He spent hours on the telephone counseling members of the MACAG group and patients throughout the southeastern United States. He felt it was his mission to learn about new treatments, procedures, specialists, clinical trials, or anything that the members of his group needed to know to keep abreast of their disease. Mac always did everything he could to offer encouragement to members of the group. He never failed to tell them, either verbally or by written word, to remember that hope is a good thing. Mac was passionate about his work with the group. Each time he lost a member, a total of 32 while he was the leader, he felt that he had not done enough to help them with their disease. Mac turned over leadership of the group in August of 2018 when he was no longer able to attend the meetings. During Mac's tenure as leader of MACAG, one of the new patients we added to the group was Michael Rosenberg. Michael eventually became a co-leader. They were the perfect combination. Mac liked to talk and led the meetings, and Michael took care of the clinical technical side. When Mac was diagnosed, it was understood that we were a team no matter what was needed. One of the things needed was the person behind the leaders of the support group. So while Mac and Michael did the talking and research, I became their wing woman. I responded to emails requesting permission to join the group, approved them for membership, typed all the newsletters that Mac wrote, and posted them to the MACAG website. I updated the website when needed, sent notices for the meetings, and made certain lunch was available for each meeting. I also spent hours on the phone talking with new patients because they always seemed to call when Mac was on the golf course. I made certain that the group ran smoothly so that Mac and Michael were available to give each member the knowledge needed to deal with their disease. Through all of this, I too became somewhat knowledgeable. I am now able to offer my support to newly diagnosed patients and their caregivers. Life was good. We did add one other blessing to our life, a Maltese named Petey. He became the joy that I needed for the days to come. From the time of his second surgery in 2008 until 2016, we enjoyed our time together. Life centered on doctor visits, testing, scans, sandostatin injections, and his work with the support group, our church, family, friends, and our dog. Unless Mac told anyone he had cancer, which was often, you would not know there was anything wrong with him. He looked good. We often heard that carcinoid was the good-looking cancer. New slide. In November 2016, Mac was hospitalized briefly for a partial bowel blockage. A 2-day hospitalization eliminated the blockage. We felt that maybe this was a one-time occurrence because in the 16 years after his diagnosis, he had never had this problem. Unfortunately, between December 2016 and March 2017, he had 3 additional hospitalizations for the same condition. Dr. Caudill had moved to Texas, so we flew there for consultation. He recommended that if there was another blockage, we would need to return to Dallas immediately for surgery. Of course, there was another blockage in April, and in May of 2017, we went back to Dallas. Surgery showed there was a huge blockage that was never visible on any of the scans. There were 10 feet of intestines wrapped around the huge lesion. After a difficult 12 days in the hospital and 2 more days in the hotel, we did get approval to return to Atlanta. From the end of May 2017 until his passing in December 2018, there were numerous hospitalizations due to difficulty with the healing of the incision, a fistula, pain, and the inability to eat or gain weight. We tried power drinks, milkshakes, high-protein drinks, TPN, but none of these worked. He was also encouraged by the doctors at Emory to go through a PRRT treatment. They felt this might help him. Unfortunately, he was worse after the treatment. In the last 6 months of his life, I began noticing changes in Mac. He had periods when he was short-tempered with everyone, including me. We had been married 50 years, and suddenly he told me he did not trust me. I could not go to the grocery store without him calling to see where I was or how soon I would be coming home. He often had difficulty remembering names, appointments, or what he told someone on the phone. He could not remember our address or what day of the week it was. Many days he was mad at the world. Most of the time he was unkind to me, our friends, family members, and to his beloved Petey. If I were to ask to rate on a scale of 1 to 10 how difficult life was for me during this time, I would have told you a 20. Even my friends and family did not realize how overwhelmed I felt. The last 2 weeks of his life, Mac once again changed back to his old self. He especially wanted his friends to visit. The night before he passed, 2 of our closest friends brought us dinner. Even though he ate less than a cup of food, he enjoyed their visiting with us. After they left, I helped him to the bathroom. He was no longer able to stand or walk without assistance, even using a walker, and got him in bed. I turned off the light and was preparing to leave the bedroom when he called me back, kissed me, told me he loved me, and said he would see me in the morning. The next morning, I found him barely breathing. I called 911 and he was transported to the hospital. That afternoon, surrounded by our closest friends and our minister, Mac finally lost his battle with neuroendocrine cancer, and he went to be with his Lord and Savior. The one blessing in all of this was that no matter what he went through, he never lost his faith in God. New slide. When Mac was first diagnosed, I became known as a caregiver, but my life did not drastically change. The only thing different was the many trips to doctors and the fact he had cancer. Because we were both retired, the trips to see doctors out of town and the carcinoid cancer conferences we went to became vacations. Initially, I went with him to all his doctor appointments and radiology appointments. We, of course, were concerned with the diagnosis, but when one of the doctors we saw told us he would most likely die of something other than cancer, we felt relieved. After his third surgery, my life totally changed. It was though I was always on call. Mac was not a person who liked to stay at home. Because of the problems he was experiencing, it was difficult for us to go anywhere. This made him extremely unhappy. Therefore, life in our house was often filled with tension. My role of caregiver totally changed. I learned to treat an incision that would not heal. I had to learn how to administer TPN in home, as the visiting nurses we were assigned had no clue as to what they were doing. I became a nutritionist trying to find foods that would appeal to him as he had no appetite. I became his secretary as he was no longer able to keep up with his appointments. I kept track and administered his prescriptions because he was constantly in pain. I became the person who cleaned up after him when he was no longer able to get to the bathroom in time. I was the person who apologized to friends, family, and our dog when he was unkind to them. I was the one to make the decision, although it was too late, to see the doctor about getting in-home help as I was no longer able to care for him on my own. Being the caregiver takes its toll. I thought I was a strong person, but I found that my health was affected. As a result of these difficulties, I did not fully recover from the knee surgery I needed. In addition, I realized after his death that I had lost a good deal of weight. I also felt guilty that I had little patience with what Mac wanted or needed. It seemed that no matter what I did, it was always wrong. I found myself responding negatively when things became heated, which was often. I became upset with his continually calling me when I was gone. I did not know how to respond when he told me he no longer had any quality of life and he thought it would be better to end things. There were days when I wished I were not burdened with a sick husband. There were many days I wished that my life would just get back to normal, or what I thought it should be like. New slide. I told you previously that our dog became a blessing in my life. This was especially true after Mac's third surgery. It was as though God had placed him in our lives because he already had this plan for us. When things became very tense, I could always take Petey out for a walk. I could always put my sunglasses on so that no one would see me crying as I walked him. I had lots of friends that I could talk to, but Petey was always available 24/7. I could talk to him, and it was though he understood what I was going through. He never told me I was wrong or that I was a terrible person for having negative thoughts. As a caregiver, you need to have a Petey in your life. It does not matter if it's an animal, a friend, parent, a sibling, or an inanimate object. You just need someone or something to lay all your trials and tribulations on. I also want to emphasize to you the importance of family and friends and how they can aid and assist the caregiver. Mac and I were very blessed to have a close group of people who cared very much about us. I always had someone with me when he was in hospital, including when he had his surgery in Maryland and Texas. When we moved prior to his death and Mac was not able to help, they were there to help me both physically and mentally. When he was no longer able to be left alone and I needed to leave the house, I had a list of friends I could call upon to stay with him. I always had friends that were willing to talk, text, or take me out to lunch. I think they realized the pressure I was under, even though I had not confided in them about everything that was happening. After the diagnosis, unless he was on the golf course or when one of us was doing work at the church, Mac and I did almost everything together. The only time I was not with him was after his third surgery. I needed to leave town when my mother died and when my nephew married. He was too ill to go with me. During the time I was gone, his nephew stayed with him, and our many friends provided meals and spent time visiting with him. So I encourage you to advise your caregivers to reach out to those who are more than willing to help, whether assisting with meals, visitations, or anything else they can do. They are the ones who provide the encouragement needed, who help you laugh, lift your spirits, and pray for you. New slide. As you're aware, the caregiver does not go through the testing, surgeries, treatments, etc. that encompasses the life of the patient, but you do all you can to make their life a little easier. Whether it's keeping track of their doctor appointments, making certain their prescriptions are picked up from the pharmacy, getting them what they want to eat, helping them to shower, helping them get dressed, driving them to where they need to go, waiting with them at doctor's appointments, listening to them, staying with them at the hospital, or just being with them. Your life revolves around the patient and their needs. You shed many tears because you know there is not anything you can do to take away the uncertainties, the pain, the suffering that the parent goes through. As a caregiver, you need to have, although at times it will be difficult, compassion, kindness, gentleness, and patience. What they need is for you to be with them, for them, to hold their hand, or to offer them words of encouragement. But most importantly, please let them know how much you love them. Thank you.